From the outset, our accounts manager, Christine, understood what we were trying to do as an organisation, that it wasn't just about a product, it was an idea and of changing culture across the organisation, because patient safety is at the forefront of this organisation. And it's about understanding our data and using it to change services and develop services. What we've been able to do is get support from Christine, is really understanding what the issues were within that data in order to interpret it, but also see if we really did have a problem. However, more recently, we've had an issue in our fracture neck and femur mortality data, and that is supporting a project that's going on at the moment, which is working with the clinicians in order to make some service improvements. When we started to analyse the data, which had been started working with our accounts manager, Christine, we realised it was the whole clinical pathway that needed reviewing in order to support much better patient outcomes. One particular area I've been working on with the Chief Operating Officer is patients who are readmitted to the organisation, and to understand the case mix. It's been a really valuable contribution from Dr. Foster. And what we want to do is reduce the number of patients who are readmitted. We want to get it right first time. So understanding the case mix means that we can work with our partner organisations and improve our clinical pathways to ensure that the patient has a safe, timely discharge, and actually they have all the support they need in the community. What Christine brings is the expertise, her experience of working with other hospitals. When I ask Christine, how's anyone else overcoming this problem? She can come up with a couple of solutions that other trusts have tried and found particularly useful. I think what is really important about the relationship with the accounts manager has been that it isn't just a product, it's a whole way of working for an organisation. It's about supporting us to gain a critical mass of clinicians who really can understand and interpret their data and work with their teams to make service improvements. And what we've been able to do with Christine is work with her and take her to the executive team. Although I'm quite happy to talk about HSMR and SHME and what that means, as is our medical patient safety lead, we don't have that level of expertise to really interpret the data and what it means for an organisation and the implications of the data. I do think that this organisation does get value for money from Dr. Foster and our accounts manager. It's an extremely responsive service, and that it isn't just about this is your data, it's more than that. It's about how can we help you to understand and translate your data and support the changes you want to make.